Okay, so after my tangent, sorry about that. Um, as I said, travel. You're gonna have to you have to pay for that out of your own pocket, and you should research a couple of weeks or a week in advance to how what the best way for you to get there would be for you, like depending on where you're coming from. So what to expect for the surgeon visit? I talked to you about blood work, but the surgeon will sit you down and talk to you, ask you questions about your health, things that you've done, whether or not you've had other surgeries, if you have sleep apnea, stuff like that. He has a checklist that he goes through with you, and then he'll invite you to ask him questions that you're concerned about. That's things that you need to know, like the OptiFast, which you get 2 weeks before surgery, and you get it from your surgeon. Um, I don't have any information on pricing, but I'm sure that if you're going through this, you can ask those questions when you go see your surgeon. Um, what time you're to be at the hospital for your surgery will come later when you actually get a surgery date. They'll tell you what time to be there for. In most cases, they want you to be there about a half hour early so you can get registered. They did for this appointment as well. I had to be there a half hour early. We were there a few hours early because we didn't know how long it would take to actually get there with the traffic, and we were taking buses and the subway system. So, and I don't know Toronto that well, so I had to take my boyfriend with me, who grew up there. So, if you have somebody who knows the area and they can come with you, that's an awesome tool to have in your repertoire, because you don't want to get lost and be late. They will only give you a 20-minute window in which to be late. Otherwise, they'll give you the option to rebook if you're over 20 minutes late. But if you don't rebook, or if you're constantly late, then they will cancel you for a candidate for the surgery. The other thing you need to think about is make a list of questions you want to ask the doctor when you see him. Um, when I After I saw him, he gave me another number to call so that I could give them my other appointments, so that they could figure out where to go from there. If my other three appointments in January go well, and the nurse and the psychiatrist and everybody passes me for the surgery, they will move up my appointment with the other doctor, with the medical internist, which is right now set for March 26th. But they will move it up if I get the okay from everybody else, and then they'll give me my surgery date. So, here's praying and hoping that everything goes well on the 29th of January when I see everybody else. The reason that they're making me wait is because the Christmas holidays and New Year's and everything. It's in November now. December is going to be too hectic, so they moved it to January. That's when they started booking for everybody else too. So January 29th is my next appointment. I have three in the same day, like I said, and then I will see the medical internist, and then I will get my surgery date. So sometime in the new year, I will have had my surgery date, and I will be a much healthier me eventually. The doctor had told me that I will come back after my surgery to see him 1 month after my surgery, 3 months after my surgery, 6 months after my surgery, and then 1 year after my surgery. And then after that, every year for 5 years to keep updated with my health and my weight loss. And by the year mark, I should be doing maintenance because I'm 4'10" and almost. Last time I was weighed, I was 198.6 pounds, and for somebody my size, that's a lot. My BMI is 41, so, and I have comorbidities, which is my blood pressure and my cholesterol. So, and my pulse is like really fast, so they're hoping that that'll all be fixed with this surgery. Also, um, I'm kind of looking forward to my kids being able to see me skinny. Because my daughter was telling me the other day that it's going to be weird to see me skinny because they've never seen me thin like I used to be before I had them, or when I was a young mom when they were too little to remember. So it would be interesting. And, like if I do this now, hopefully by the summertime, I will be a much thinner me, and my grandbabies, I have two granddaughters, will not know me as this. They'll know me as a healthy grandma who can take them to the park and play with them and chase them around. And that's what I'm doing this for, is my kids, my grandkids. I want to be here for them to see all the things that, as a parent, you have brought kids into the world to see. Like, I want to experience my grandchildren, not just be there and be too unhealthy to do anything with them. So, this is everything for now. I'm going to do an update again. Probably won't be till January, but I might do um, a small haul video about things that I'm going to be getting before my surgery date. So stay tuned for that, and I hope to see you soon. And good health be with you.